Hi, my name is Talia MK and I have with me Dirk Sven Kircher, who is the medical advisor of Medi24 Service AG. Hi, how are you? I'm so honored to be here. He's also receiving an award for Health 2.0 Outstanding Leadership. So first of all, I would like you to introduce yourself the way you want to and your organization.
Thank you so much. I appreciate to be here. So really exciting to be here. And yes, I'm a health economist, and my base is the specialized nursing care, also a paramedical assistant. And my yes, goal is to keep the nursing staff more and to give them release with digitization, and of course it's necessary to keep them. It's more cheap, of course, than to lose them and to search for new stuff. And that is my main intention to keep them with a new working guide. So I also made some analysis in Switzerland to keep them and what is necessary to keep them, and of course the digitization could give them relief in administrative work, also in the documentation for the nursing documentation, and it's a main part and important part in the health record documentation. And yes, there are developments in Switzerland as well, and across the border in other European countries too. And yes, I'm happy to be here and to give some more details about it in the Middle East, and to check what is around here and how are the developments here, in which state. Thanks so much.
So you were an honoree of this conference of Health 2.0 Winter 2020 Dubai, and you're getting a recognition for your accomplishments. How do you feel about it?
Thanks so much. I'm really happy and I appreciate it. So, because my intention is to bring this yes, important fact to other peoples, to other countries, and yes, to find the right stuff and to keep them. And that's my intention, and I'm so happy to give this information further to other peoples.
So if somebody who wants to follow your footsteps, what would be the advice you would give them? Any specific advice?
Yes, keep our healthcare system and procedures more human. Not only efficiency triggered, more quality oriented and patient-centered. So also to develop the PROMs, patient outcome measurements, are important, to have this value-based, I repeat it, value-based healthcare system. That should be the next steps. Not only for return on investment in the short term, so also for the middle term. It's more important to have more return on investment, to invest now and to get the yes, the results later a bit, of course.
So how has your networking and learning experience been in Health 2.0 Conference Dubai Winter 2022? What is your, how are you feeling about the networking over here?
It's so exciting to meet some people from all over the world, and that it's for me important to get an impression how far is the healthcare system in the developments in other countries. It's not a good solution idea, in my opinion, to focus on the just one country. So, and that's very exciting for me to learn and each other and yeah, take some more feedbacks.
So if anybody want to collaborate with you or take your advice, where they can reach you and how they can reach you?
Oh yes, they could reach me with our websites, HCS consultants.eu. And yes, at the moment I also make pro bono consultations and advices, consultings for hospitals, and of course for the long term in institutions in nursing care too. And if they want to have advices how to keep this staff in a retention management a bit better, I could give some advices, of course.
My last question. So I just would like to know, like, how are you feeling about the feedback? How do you take criticism when it comes to the company? Because it's something very important. It's something, when health is related to, it's like about everyone. So everybody is very much critical when it comes to health, there rather than when we are talking about other experiences. So I would like to know how your company take criticism, and how fast are you to take the changes, or take that into account and make the changes or amends for your company. How do you do that?
A good point and very important question. Thanks so much to you. I work for Medi24, a service company and a pioneer in Switzerland for the telemedicine advices. So we are one of the fastest growing branch in the healthcare industry at the moment, with growing figures over 10% annual. And of course, our company share the new work philosophy as well. And the most important point is to participate, to share the values, to have a goal for everybody, and the transparency is very important to know for each working staff, also at the base, what is going on, and to share this value, and to find some more innovation goals as well, to get a better feedback culture. One point I want to pronounce, what you asked me, is the zero mistake culture. Of course, it's important not to make mistakes to the patients, of course, but the feedback culture is a bit more. So everybody is human and could make mistakes, and that should be a cultural change, a deeply paradigm change at the moment, to not to be afraid to make mistakes, to learn about it. That's the most important point. Thanks so much.
Thank you. Thank you so much, Dr. Dirk, and it was a pleasure knowing you. I hope you have a good time in Dubai after your conferences. The weather is kind of getting good. So I hope to see you around, and I hope that you get whatever the experience you were dreaming about or hoping for. And this is Talia MK signing off. Have a great day.